So yesterday I was telling about being fully aware of our time with patients. I just wanted to put a small thing for you. So just think, see this patient, 45-year-old man has come with epigastric pain for 1 week. So actually he had gallstones diagnosed about 2 years ago. But this time I could not find any reason why he should be having pain because the gallbladder was not inflamed. But I suddenly noticed that his superior mesenteric artery was a bit bigger than normal. And when I zoomed into that, and that is what you could see. So anybody has any ideas what we are looking at? I hope some of you made the right diagnosis. So this is the color Doppler. So this patient actually came 2 days ago to our hospital. And there is a dissection of the superior mesenteric artery. The intima has lifted off and there is a 70% obstruction to the lumen. And we sent this patient to an interventional radiologist. So I just wanted to tell you that if you are not careful, you would just say a patient has gallstones. And maybe a day later, he comes with very severe abdominal pain, and then the entire bowel is gangrenous. So we need God's continuous presence to make sure that we don't miss something that might kill a patient or cause severe morbidity. So it all depends on recognizing what we see, and that depends upon excellence in our studies. So this is the topic for today. Where will our staff come from? So I want to take you to another hospital, the Christian Fellowship Hospital in Ottanchhatram, where I worked for 3 years. 1987 to 1990, I was a junior doctor in this hospital. So after joining this place, I went and requested the director, Dr. Tarian, that I have 2 requests. The first one was I wanted to do village evangelism. I wanted to go into villages every Thursday, and I was permitted to do so. So for 3 years, every Thursday, I went on my motorcycle to villages on the hills of Pachalur, some distance away from this hospital. My second request was that I be allowed to help organize the medical missionary camps. So this hospital, Christian Fellowship Hospital in Ottanchhatram, was conducting these medical missionary camps every year for Christian medical students interested in missions for the whole state. So this is something I would like to suggest to directors of hospitals or maybe even people running programs for a country. Can we do something like that, a medical missions conference? It doesn't really cost you much. At Makunda, we do that for our local medical colleges. It might cost about 50,000 or 1 lakh Indian rupees for the food. Accommodation is given in our hostels. And we just need people to come and discuss and talk and share their thoughts. So for nearly 5 years, I was involved in running this camp along with other people. And I visited every medical college in Tamil Nadu and interacted with people in those fellowships. And this is what I learned. This was about 33 years ago, but I think a lot of it still holds true today. So I think some of you are medical students and you are having fellowships in your colleges. Maybe you are nursing students or paramedical students. So I request you to ask, why do we exist? Very often the answer is so that we may have prayer, Bible study, and worship. And what do you mean by worship? Having a time of singing. So that is all that we do in our fellowship. But let me suggest that the real purpose of the fellowship is preparation for the life that comes after college. So in 4 more years, in 2 more years, next year, I am going to leave this college. So am I ready? Have my decisions been made? Have I been prepared as much as I can for what is in store for me? So that should be aim of the fellowship. So each one of us has some issue in our life. Some of them can be overcome, some of them cannot be overcome. For example, I am handicapped. I may not be able to overcome that problem. My father drinks alcohol and he beats up my wife. I can pray for it, but very likely that is not going to change. So I need to overcome the issues in my life that can be overcome and learn to live with those that I cannot and move on with my life. I cannot keep on dwelling on things that are bringing me down. And what is the work of the fellowship? To encourage people having such issues. I want to say, be a friend to everyone. So who is a friend? A friend is someone who encourages you to do the right thing, encourages you when you have difficulties in doing what is right. And he is also a person who warns you before you fall into the ditch. So get friends like that who will very bluntly tell you are going to make a mistake. And it is an opportunity for people to excel in their studies. So how can a fellowship help? So I was part of 3 medical college fellowships. Kilpauk Medical College where I did MBBS, Madurai Medical College where I did my MS, and Christian Medical College Vellore where I did my M.Ch. In all these places, I conducted classes for people who are not good in their studies. So God has blessed you with some knowledge. God has helped you to excel in your subject, maybe anatomy or physiology or whatever. Why not share it with other people? I will tell you, if you do that, you will never forget what you have learned. The best way to forget is to keep it to yourself. And that is how I still remember a lot of things I learned in my MBBS days. Discover God-given talents in each other. Each one of us is unique. We have great talents. Help us to develop those talents. Shaping personality. Some of us are very introverted. So we need to help from others to pull us out of that difficulty. To develop empathy for each other. If we can do all that, then our fellowships will be a transforming impact. So I always say transforming impact in a hospital. Should we not have transforming impacts in our colleges too? So who should take our fellowships, our Bible studies? So I encourage that each student be trained to take a Bible study. So it would be wonderful if we had a speaker like Dr. Arul Ankatil taking all the 52 Bible studies, would it not? But then we do not develop the skills needed to take Bible studies, to learn for ourselves. So it doesn't matter if we are not very good at speaking, but let us take our Bible studies. And then in what we encourage is have 3 Bible studies, and the 4th week have a taking stock meeting. So in my MBBS days, we started a Bible study in my college, and the first taking stock meeting, everybody looked at each other, and then they said, "Let us sing one more song." And then after about few minutes, one person said, okay, I will share. This is what I read from the Daily Bread. A few days later, a girl said, I have been asked to meet the dean because there was a complaint against me. Actually, this is my second college. I was in another college and I was shifted here on disciplinary grounds. So if it goes bad, I may not be coming again. I just wanted to tell you that. And then she said, I have no friends here. I have failed in all my exams. My parents don't like me. And then she said, what are you going to do about it? So this was our first genuine sharing. So then we said, okay, first we will pray that you will not be sacked. You will continue to in this college. And then some girl said, when you have experienced loneliness, come to our rooms. We will be your friends. And some of us who are good in studies said, we will teach you. So this is the sort of prayer that is answered, because we are willing to be part of the answer, isn't it, to the prayer? And it is not one by one, all her problems were resolved. Sometimes people don't come to our meetings. So we had a simple formula. On Monday, one person will go and ask, why didn't you come? We really missed you. Tuesday, another person will go and ask. So after 6 different people have come and asked, then you don't feel like not going again the next time, isn't it? So I feel that the life of a fellowship actually depends upon how much we spend time with each other, just like staff in a hospital. So these are some golden rules we made, 5 golden rules. We exist so that we help each other to change. And our opportunity is lost when we pass out of college. So what is the difficulty that somebody else is having where I can make a difference? The impact of the fellowship is proportional to time spent outside the fellowship with each other, in our hostel rooms, in each other's homes, in our studies. Intercessory prayer will only be allowed if you are willing to be part of the answer. Our members are one family. We take care of each other. We had many people who are non-Christians who became our members. So when they did so, some of them were disowned by their family. You are not my daughter. You are not my son. Don't come and ask me for money. So what did we do? So we said, we are your sister, we are your brother. From our pocket money, we will pay for your tuition fees. In those days, tuition fee was only 300 rupees a year. So we could pay for the fees of people who had been disowned by their families. And invisible leadership at higher levels. So I already told you that a towel leader is tries to be as invisible as possible and give visibility to the people working under him. He becomes visible only when a mistake has happened and somebody has to own up for that. So in the same way, in our fellowships, the senior leaders should not be very visible, and they should only come out when something has gone wrong. So this is what the Bible says. By this shall all men know that you are my disciples, by the love that you have for each other. If we can do all these things, our fellowships will grow. So if your fellowship is not doing very well, stop for a moment and think, are we doing some of these things? Or are we just having Bible study and maybe some good singing? Is that why we meet? Let me tell you a story. In one of the medical colleges, there was a boy who was drunk all the time. And one day he came to the fellowship, and after the meeting was over, he said, can I say something? So we said, okay. So he said, you know that I am the worst drunk in this college. I want to stop drinking. So please tell me what I should do. So we did not know what to tell him. So we said, please come back next week. We'll think about it. So the next week, there was a sale where they were selling badges and calendars and so on. So we bought a badge in which it was written, Jesus loves me. So we told him, please wear this badge. So he said, if I wear this badge, will I stop drinking? So we said, we don't know, but wear the badge and we are praying for you. So about 1 or 2 months went, and then he came again. And then he said, can I speak again? So we said, okay. So he said, I stopped drinking. So he said, the problem was not that I loved to drink. The problem was, after college, I went and sat in my hostel room, and 3 other boys, they came and sat on the bed. Then a little later, the boys got up and they went to the liquor shop, and automatically I went after them. And at the liquor shop, they drank a little bit and then they went to study. But I had a lot of money, so I drank and drank and drank until I was unconscious on the pavement, and somebody else had to pick me up and bring me to the hostel. So he said that was my life. But this time I was sitting there with a badge. The 3 boys came in, and then they went to the liquor shop, and I walked after them, and they said, no, you are not coming with us. They didn't want me and my badge in the liquor shop. And he said, I completely stopped. And a month later, the second worst drunk in college came and met him and said, I know who you are. I cannot believe that you have stopped drinking. So tell me, what did you do? So he said, no, actually, you have to wear a badge, and then you will also stop. And you know, everybody was very curious how a person who is drunk, who fails in all his exams, who doesn't wear good clothes, has suddenly shaved, is wearing good clothes, speaks well, attends classes, passes his exams. And then they realized that is because he goes to a fellowship. So they said, let's go and see what they do there. And that is how fellowships grow. And you may be surprised that there are 100, 200 people in your fellowship, because lives are being transformed. And people will come out of curiosity to join your fellowship. The needs of the country, the needs of people, the needs of the neediest should also be brought out for discussion, so that people will be willing and be challenged to take them up. We should categorize them into young Christians, growing Christians, and those in the final state. So where are our members? Which state are they in? Because we need a different way of handling each type of person. So there is a person who keeps on saying, I want to go into missions. So how can I direct him? How can I provide him with the knowledge, that the training that he needs? So somebody says, I have decided to take missions as a career. What should I do next? So I suggest that you read biographies. Nowadays, the internet is there. You can download books from the internet. You can borrow books from the library. In every medical college we had at the time, we had a box of good books. Each book could be read in 1 week. So it is like a circulating library. Each week you borrow one of those books, and next week you put it back. Somebody else can borrow it. So it is another good suggestion for those of you who are still in college. So why don't you buy good books which will help people as they grow in Christ and as they consider a career for themselves. Visiting hospitals during breaks. So we all have vacations. There are breaks between final year and internship. So at our hospital here in Makunda, we had a room. We built a small room behind our house where 6 students can sleep. So they can come and stay, free food and lodging. They can talk to us every day in the evenings. They can come for rounds. They can just see for themselves whether this is what they would like to do for a long-term career. And you will not be surprised. I will not learn that many of our recruits have come and joined us like that. They have come here during their student days. They've seen and felt that this is what I would like to do all my life. And then there is no difficulty in taking the right decisions, no difficulty in telling your parents what you want to do. College campuses are also the time when your personality and leadership are developed. And if you take all the right decisions while you are in college, you will never regret it, because personality becomes more and more difficult to change as you grow in age, and you're molded when you are in college, and especially when you are with good friends. Also a place to make good plans for your life and get help from good mentors to make the major decisions. So this is the sequence I suggest. Where will I go? What sort of place do you want me to work in? I have been sent. I am a citizen of the kingdom of heaven, posted here on earth, and you are my commanding officer. Where are you sending me? And then once we know where I am going to go, what will I study? So you study what is needed. Your post-graduation should not be your master, it should be your servant. So I already told you I had a fascination for cardiology. I still do all the echocardiograms in my hospital. But that is not what was right for this place when we came here. At that time, it needed somebody with surgical skills, and that is why I did surgery. Whom will I marry? So what are the gaps in my personality? What sort of person am I looking for? So in my life, I was searching for someone who will fill in those gaps. I told people in fellowships, if there is some girl who is interested to go to missions like me, please inform. And I got a few answers from various colleges. And then I used to write letters and say, I heard about you. Can I meet you? And I interviewed some of these girls. Why are you interested in missions? And then little by little, I knew this is not the right person. And finally, I met my wife. So she had been to a very remote place in Gujarat, and I had been to the same place. And she said, I would like to work in a place like that. And then I knew this must be the right person. So God will help us, because God knows not only what a person is today, but what a person will be like 20 years from now, 50 years from now. And He will give us peace and that understanding that this is the right person. I have also been trying to tell people, why don't you consider this gap year? Many countries abroad, students take a gap year after their undergraduation to explore the world, to look around and say, is this what you want me to do? And maybe God will completely change your mind in that 1 year. And why not spend that 1 year in a mission hospital and say, is this for me? And then many of your questions will be answered, your skills will be developed, and you will find yourself in the right place. So the people who are born between 1997 and 2012 are called Generation Z. They are also called the digital generation. So part of their life is in the physical world, and part of their life is on social media. They live in their phones. They are also willing to delay gratification. So they waiting a year, making sure about things. They are more adventurous and risk takers than previous generations. So how do we engage with these people? We need to be invited into their bubbles to engage with them. So we need to be friends, engage at some common point, and then we can relate with them. And I think that this generation will provide a greater boost to medical missions than all the generations that had gone on before. So let us understand the people with whom we work. These are the people who will uh, take missions into the future. And we cannot keep on thinking that everybody will be like us. We must learn to enter into other worlds. So I say that there are two types of junior doctors. I can probably say junior nurses and everybody else. Type A wants to have a lot of free time so that they can have less work and a lot of study. Type B want to gain an experience that they did not get during their MBBS. So for a place like Makunda, a type A person will be a big disaster, and they themselves will find it very difficult because the work is so heavy. But a type B person will really enjoy themselves. So we had a junior doctor who spent 2 years in our hospital, and during that period she did 500 cesarean sections. She just wanted to learn more and more and more. So when you go and recruit, have a short interaction and try to see what sort of person is this person. So when we hire consultants, we should enable them to develop their departments. So that is what makes a person satisfied. Salary is just one element. Many of our mission hospitals cannot give good salaries, but the other elements that you provide are more than enough. People will still come even if you give them a small salary. And we must have a plan, human resource plan. Every staff should gain the most that this hospital can offer them during their time with us. So somebody is going to be here for 2 years. So during those 2 years, what are all the things that we can teach? So if you can do that, you may meet staff many years from now and they will tell you, the best years of my life was in your hospital. I was there only for 1 year. I was there only for 6 months. But I will never forget all the wonderful things that I had there. And I already said that we should not mind sending our best staff to other hospitals. We need to be with them when they are sick. So I went to a meeting where one nurse came and told me, you may not remember me, but please tell your wife, madam, that I will never forget that when I was sick, she made soup and gave it to me in the hostel. She noticed that I was not well. So she was like my mother. Similarly, there are maybe students in the hostel. So one student told me, I missed home because I did not have a birthday party. But your wife, she made a small cake for me. So these are the things that people remember. And people often have an idea that mission hospitals are places where people treat diarrhea and loose stools and things like that. So this is a young lady who came to our hospital shortly after I completed my M.Ch in pediatric surgery. So that thing in the CT scan was reported as a hydrated cyst. And I had done research on hydrated cysts of the lung. So I did a thoracotomy, and that was not a hydrated cyst. It was a teratoma of the middle lobe. So I removed part of it, and then she went away. She came back 5 years later with the second X-ray. This is the second tumor. The tumor has grown much bigger. The first time she came with massive hemoptysis, and now she had again come with massive hemoptysis. But now she was a mother, and she had 2 children. And that is my wife. She has given anesthesia with a double lumen tube. And we have done a right middle lobectomy. We have removed that tumor along with the 2 ribs on the top. And today, about 20 years later, this lady is really doing well. So these are the challenges. So working in a mission hospital is a great challenge. It's a professional challenge because We do not have support systems. We do not have many departments. We do not have many staff to help you. But when we are vulnerable, God is by our side. So that is a great privilege that we can experience the power and wisdom of God when we move out of our comfort zone and know that without God, I cannot manage. So there are so many stories like this we can tell from our many years in missions. So very often we take the safe choice where everything is in our control, but then you will not see God in action. Miracles happen because they need to happen, and you need God in those circumstances where He puts you. So when new staff join, give them a pleasant orientation. Tell them who you are. Tell them what your hospital mission statement is. Why do we exist? And we have 3 days of induction process where we explain everything to them. Where am I? Which is different parts of the hospital. Who is this new staff? So a new staff is not just a nurse or a pharmacist. They are passionate people. They have talents and all these things we need to discover. So usually my first question is, what are your hobbies? Because that is where the talents lie. What are their strengths and weaknesses? Welcome them to a meal in your home, cooked by yourself, and talk over what they are experiencing. Help them when they are discouraged. I think all that I have already said. But we must remember that the most important people are not the people who are the highest, the directors and the department heads, but the sweepers, the drivers. So when these people know that you care for them, a caring ambience develops inside that hospital. And that is how a good hospital becomes a great hospital, because people start caring for each other. And we need to give visibility to those who need it. So what are your hobbies? So this is my hobby. So we discovered that many of the nursing students who joined our nursing school were planning to drop out. So I asked them, why are you dropping out? So they said, because I studied in Bengali medium. I studied in Assamese medium. I cannot understand anything that is taught. My exams are going to be in English. I don't think I can handle this. So then we started calling these people and talking to them. And we discovered that some of them are great dancers. Some of them are great singers. So we organized a cultural program and said, please tell us how you dance in your tribe, how you sing in your tribe. And these girls, they danced and sang. And then they said, there is one thing which I can excel in, which is appreciated in this hospital. And therefore, I will stick on. So we need to look beyond qualifications and beyond experience. That is one of my photographs. So somebody takes a good photograph, somebody sings beautifully, somebody dances well. I think we should appreciate them. Our hospital has invested a lot of money in an excellent sound system and in costumes for dancing, because people here in the Northeast are really passionate and excel in all these areas. And that gives new meaning to each person in our community. And recruitment and retention is a very long process. So we need to think. If you are able to recruit 100 people That means you go to different conferences, you give out your email address and your contact details, and people call you. Only 10 of them will join you when they complete the course. So you may think so many people have applied, but actually only 10 will be willing to come to a faraway place and join you. And out of those 10, only one will stay long term. So just think of how much of effort you need to put to have enough people, not just enough people, enough highly committed, highly motivated people. So how do you fill your hospital with highly motivated and committed people? It is only by hard work. And my wife and me have traveled across Northeast India to every state, to every medical college, every nursing college, every paramedical college. We have stayed in their hostels. We have visited their homes. And that is how you get top quality people to join you. There is no shortcut. And we need to spend time in prayer that the best people will join us. And they will. And when they have joined, you find out what is God's plan for them. Maybe they should go and work in another hospital. Find out what that hospital needs. And during the time they spend with you, train them so that they will do an excellent job there. So I think if we can do all these things, we will not face difficulties. It does not matter how remote or how difficult your hospital is, and how unpleasant it could be to work there, how many inconveniences there are. God will send you the right people. I just want to tell you a small story. I started a small group and we all worked together to join a mission field. But little by little, all of my friends had to leave for one reason or the other. Most of them joined postgraduate courses. And I had a friend in YWAM in Chennai, and I went and told him, I do not know what to do because I am the only one left of this team. Should I go forward, or is God telling me that He has another plan? So he said, I would like to take you to a lady who helps us when we have difficulties. So I am not a person who looks for supernatural answers to prayer. I believe that God most of the time speaks to us in very logical terms. But this lady, she looked at me and said, you were planning to go as a group, but the others have left you. And now you are wondering what to do. Is it not your problem? And I said, yes, that is my problem. So she said, God has disbanded your group. And one reason is because this hospital where He is going to send you does not require so many people. There is no work there. So when you join, there will be no work. But little by little, work will increase. But God will give you strength to manage. At one point, the work will be so much that you cannot manage on your own. And at that point, God will send you people you know nothing about. They will come and join you from different places, faraway places, different tribes, different countries. And therefore, go. So that was a very remarkable experience. And I never forgot it. So in all those years when we had nobody willing to come and join because there was no water, no electricity, so much of difficulties, we are unable to pay salaries, and people fighting with us, beating us up, filing court cases. I was telling you there was no electricity and water. That was not for a year or two. For 14 years, we had no electricity in our homes. but this promise was there. This sort of vision was there. This prophecy was there, and that kept us going. And that was what happened. Today we have about 400 or 300 people in our staff, all of them highly motivated, and it was God's doing. So don't worry. If you can just learn to trust and to obey, God will provide the people you need.